A tragic and cautionary tale tonight for parents of teenagers who suffer from depression and anxiety.
And a warning about some antidepressant drugs. All antidepressant drugs prescribed for teenagers carry what's called a black box warning. That's a warning that alerts doctors that the drugs may have dangerous side effects, possibly even leading to death. KI News Investigates has been looking into these drugs, what the Food Administration knows about them, and what part Texas health officials played in approving usage of these drugs for Texas children. Nancy Wilson now with the whole story in this KI News Investigates.
Loved school in the 5th grade, was a good student, wanted to be a veterinarian, loved animals.
Glenn McIntosh talks about his daughter, Caitlin.
I remember the first day of 6th grade, she rode her bicycle 45 minutes early. She just got there early almost every day for the first few weeks because she just loved the idea of going to 6th grade.
Then it started to change.
She quickly found out that she didn't fit in. She wasn't in the popular group.
Caitlin was having trouble sleeping, feeling like she didn't fit in. They thought her doctor could help.
What did he do? He says, I've got just the thing. Have her take Paxil, because Paxil will help her sleep, and it sounds like she's depressed and having trouble adjusting. It'll help her depression too. We've got a win-win here. Give her Paxil.
But it didn't help.
She immediately became worse. Her behavior changed. She became more depressed, more like a zombie.
On January 5th, 1999, after 2.5 months on antidepressants, 12-year-old Caitlin, locked in a stall in the girls' bathroom at Cedar Park Middle School, ended her life. Since then, Glenn McIntosh has become a vocal critic of prescribing antidepressants to children.
It's the only way I can make something good come out of Caitlin's tragic death.
The suicidality event data.
The McIntoshes testified before the FDA in hearings that made national headlines.
On the Health Watch tonight, action on a long-running medical debate. FDA advisors said today antidepressants can indeed pose a suicide risk in some users under 18.
The FDA took action.
We're informing all manufacturers of antidepressants that the labeling for these products need to include a black box warning addressing the risk of suicidality in pediatric patients.
That black box warning, the FDA's strictest warning, is reserved for drugs with the most dangerous side effects.
It was a horrendous day for us.
After hearing dozens of similar stories from grieving parents, the FDA issued the warning after conducting its own analysis of data that was never published. Data drug maker GlaxoSmithKline now admits it withheld from most doctors. But we learned there were some doctors who did know, doctors right here in Texas. One of the studies was conducted by researchers at the University of Texas Southwestern Medical Center in Dallas. Besides the risky side effects, data from their study showed Paxil was no more effective in treating depression in kids than a placebo, no more effective than a sugar pill. Psychiatrist Graham Emsley led the study.
Some of the companies have provided physician information out on some of the studies. We'd been involved in most of them. Some I already knew the data, but I couldn't talk about it because it was proprietary.
It was confidential because Emsley did the study for the company that makes Paxil, GlaxoSmithKline. He's also a paid consultant for other drug companies that make psychiatric drugs, like Eli Lilly, Bristol Myers Squibb, McNeil, Novartis, and Wyeth Ayers. The state of Texas hired him to help evaluate which drugs were best to prescribe for children with depression. On the recommended list, paroxetine, otherwise known as Paxil.
The placebo response rates.
Len Krisman is in charge of the Children's Medication Project, which is part of the Texas Mental Health Department.
So if he knew about it, do you think he had a duty to come forward to you and say, this does not work, we're not doing our children a favor by allowing them to take these drugs?
If he knew about it and he felt like the results of the study were legitimate, then he has a duty to communicate that.
Former Pennsylvania Assistant Inspector General Alan Jones investigated antidepressants in children.
At the time they made these recommendations, many of those physicians had participated in numerous failed studies. They knew of the dangers. They knew of the lack of evidence of effectiveness, and still they recommended the usage of these drugs in kids in Texas.
Joan Claybrook, president of Public Citizen, is alarmed.
Well, it's shocking first because of the impact on citizens and human beings and the harm that occurs. And a doctor takes a Hippocratic oath, to protect the patient. And it doesn't matter that he's a researcher versus the prescribing doctor, that he knows this and doesn't tell anybody. is really outrageous.
Glenn McIntosh says the public needs to know.
My heart breaks when I hear ongoing stories of people committing suicide, murder, one after another, because they were on these drugs while they're debating and, you know, trying to do what they're going to do and wait for the warnings to come out in 6 months or whatever. People are dying on these drugs.
Earlier today, we pulled this list of recommended antidepressants off the Texas Department of Mental Health's website. Now, while all of the antidepressants recommended now have the FDA's black box warning, there was nothing to indicate any increased risk. We also found that 3 of the drugs on the list were withdrawn from the market more than a year ago. The Children's Medication Project won't be updating the list anytime soon either. They aren't even scheduled to meet to discuss the changes until next January. Nancy Wilson, KI News investigates.
In the past 2 years, taxpayers have paid more than $113 million through Medicaid for antidepressants prescribed to Texas children. All antidepressants, with the exception of Prozac, are banned for use in children in Europe and Canada.